On the morning of surgery, before you come to the medical center, remember, do not eat anything 8 hours before your arrival time. Do not put any creams, lotions, or oils on your face. Remove all jewelry, including rings, earrings, and watches. Do not wear contact lenses to the surgery center. On the other hand, here are things you should do that morning. Bathe or shower to minimize the chance of infection. Clean your eyelids and apply 1 set of preoperative eye drops if you were prescribed any. Brush your teeth or dentures. Wear clean, loose-fitting, comfortable clothing that buttons down the front, and don't wear clothing that pulls over your head. You can wear hearing aids and or dentures if you were prescribed any. Take your heart, blood pressure, seizure disorder, and Parkinson's medications with a sip of water if you normally take them in the morning. Bring any inhalers you've been prescribed with you to the surgery center. Feel free to bring earphones to listen to music or other audio material as you wait for your turn to have surgery.
Register at the Eye Surgery Center, Department 494, at your scheduled arrival time. Plan to arrive 30 minutes before your appointment in case there are issues with traffic and parking. Expect to be at the Eye Surgery Center for 3 hours. Bring your Kaiser Permanente card, photo ID, and the co-payment for your surgery, which can be in the form of cash, check, debit card, or credit card. The co-payment amount will be collected on the day of surgery by the admitting department. Special arrangements can be made for prepayment. Please contact the admitting department at 408-851-5400 to discuss your options. If you have questions about your co-payment, please call Member Services at 1-800-464-4000. Plan to give your wallet to a family member or friend for safekeeping during your procedure, along with your other belongings. Bring the medication list form that was given to you, which lists all of your medications and the last time you took them. When it is time for you to be prepared for surgery, you will be led into the preoperative area. One person is welcome to stay with you until you go into the operating room. In the preoperative area, you will be asked to change into an exam gown, but you'll be able to keep your pants and shoes on. While you're in the preoperative area, you'll be asked to read and sign the surgical consent form. Several care providers will come by to take your medical history and examine you. As a result, you may be asked for the same information more than once. An intravenous or IV catheter will be placed into your arm so that we can administer medications to make you feel more relaxed. Again, have your medication list filled out ahead of time so that you can give it to the nurse. You'll be asked several times which eye or eyes will be undergoing cataract surgery. We hope this doesn't alarm you. It's not because we don't know which eye to work on. We do it to confirm the operative site every step of the way. A nurse will place several dilating and numbing drops into your eye, and your surgeon will stop by to mark the eye or eyes that will undergo the operation. Try to use the restroom whenever you are asked. Waiting to go until right before you're called to the operating room can cause delays in surgery. Your operation. You'll be transported into the operating room on a bed called a gurney. Once in the operating room, you may hear the surgical team go through a checklist to ensure that your name, medical record number, site of the operation, and lens choice are all correct. We will clean the operative site and place a sterile drape over your face to help prevent infection. You'll still be able to breathe, and oxygen will be flowing through your nose. By this time, you'll start to feel the relaxing medication or sedation working through your IV. This will keep you comfortable during surgery. We use an eyelid speculum to gently hold your eyelids open during surgery. If you are having cataract surgery on both eyes the same day, one eye operation will be completed before beginning the second eye surgery. The two operations are carried out as two separate procedures, and new instruments will be used on the second surgery to prevent cross-contamination. As you can imagine, it's really important to keep your eyes, head, body, and feet still during surgery, as any small movement will make it more difficult for your surgeon to operate on you. Avoid talking unless you're uncomfortable, in which case you should feel free to tell your surgeon so that more numbing drops or sedation can be given to help make you more comfortable. It's important to communicate with your surgeon about any discomfort rather than to hold in an urge to move, such as a cough or sneeze, and then make a sudden impulsive movement during surgery. You'll see a very bright light at the beginning of surgery. Thereafter, you may notice moments of blurred or darkened vision, colorful images, and moving objects. You'll also hear noises that may sound like low rumbling or bells dinging. These are sounds coming from the machines used during the surgery. Near the end of the procedure, you may notice that objects suddenly come into focus as the lens implant is placed into your eye. You will hear your surgeon talking to nurses and assistants in the room throughout the procedure. After your surgery is done, the eyelid speculum will be removed, as well as the sterile drapes. We'll tape a clear shield over the operative eye for protection. Then you'll be brought to the postoperative area and offered something to drink and a light snack, such as crackers. You can expect to go home about 30 minutes after your surgery. You may not drive yourself home or take a taxi home, as the sedation can cause prolonged drowsiness. If your ride cannot wait for you, we'll call your ride when you are ready to leave. Your ride must come to the eye surgery center to sign you out. You may want to have someone stay at home with you for a few hours after your surgery.